could have been that it was just already manifesting
Right.
itself. So.
Sure. And of course, the 3-week mark isn't magic. It's just that it's gradually lowering. So if you're, susceptible a little bit, and you get a good exposure to something,
Right.
even if it's 2.5 weeks, you still might get it. You know what I mean?
Right.
Now you have a quorum folder already for your IVIG, don't you, honey?
Yes.
Yeah, can I get it for you so you don't have to get up?
Yeah.
Somewhere
Well,
nearby.
I gotta. Dig
Only
for it.
because I'd like to keep your orders in the same spot and keep it a little bit organized for you. Insurance guidelines. The extra. Is that another paper coming?
Nope.
Oh, a person coming. Hello. Hello. I'm Colleen, the nurse.
Hello, my name is Bethany. I'm her mom.
How are you? Oh, you're the delivery woman.
Yeah.
Thankfully, you worked right nearby. Huh?
Yes, yeah.
That's great. And so you'll be getting the deliveries weekly?
Is that what it is? Okay. So
Yeah,
they'll
it
be
is
sent there
weekly.
weekly?
Yeah.
Okay.
They'll probably call. I guess they'll call Angela though, and not you.
Right.
Just make sure that everything's set. And I just didn't know if it was going to be an ongoing delivery or if it was just this one time. But if it's good for you, that'd be convenient for her, I think. So
Yeah.
she needs
Oh, yeah.
a
'cause I'm
signature,
only-
right?
Yeah.
Yeah.
And we always have somebody there, so it's
Yeah.
not taking a chance of somebody not being,
Exactly.
at home or something.
Oh, that's excellent.
Hey, Daisy Bacon.
And it's easy for you guys back and forth because you're so nearby.
Mm-hmm.
Beautiful. Oh, here's the infusion log. This is what I wanted to see.
Do you guys have any other lighting? Can you see it?
Good. And here's your thing we were talking about, right?
Yes.
Oh, no.
Yeah.
How do I know?
I don't have
That one doesn't work.
Do you need more lighting in here?
You know, it's kind of a blue folder.
You know, all the doctor's appointments I've been going to, I bring them.
Do you bring that with you sometimes?
Yeah.
Oh, do you?
And they end up ripping, to be honest, so I end up.
Doug, did you get to, have you started
No.
yet?
Not
Oh, they
yet.
haven't? Did you get to honor to do the first one?
No.
No.
Are you going to be doing some of this as helping?
Eventually.
No, she won't, he might.
That's cute. And you know,
Well,
here's this delivery copy of what you signed when you
Right.
received it, you know? So I'm just going to keep that in here for you.
Okay. Well, hi, Daisy.
Back.
See, Doug, you can be like my mom, though, and my dad, who used to have to get shots for his diabetes, and she would have to give him his shots, and he found that she was getting too much pleasure out of it.
I know. I always joke about that because, hey, you want to be nice to the guy with the needles, so you want to watch it. You can always get a little frustration out there.
Yeah.
That went in a little bit. That went in a little hard.
Would we be able to get it next week?
Yeah, it's no big deal, really. It's
You
just,
just
I
want
kind of
the-
wanted to see, some of the past notes, maybe about your vital signs, and also I was just going to put your order in there and just keep you organized. But
Okay.
we'll do it next week.
Okay.
No problem.
Alright, I'm sorry.
No problem, honey. And this I was going to put in there too. This is just an example of your delivery ticket.
No, it
They're
doesn't
going
work.
to come every week. You might not want to keep them all. But I thought, well, I'll keep this one for you in
Is that
here
not
just
what-
because
Yeah,
it's
that
going
one
to be your
doesn't work.
typical stuff that they send you.
Should I
And-
know what to have asked
Yeah,
for?
I guess it's probably maybe if there was ever an insurance issue, you did receive your stuff. I don't know.
I usually keep all the paperwork in there.
Yeah, I'm like that
So-
too. So you'll end up with a big stack of these. So you might want to just put them somewhere else because it'll fill up your folder too much,
Right.
you know.
Right.
But I thought today I'd put it in your folder. But we'll do that next time.
Okay.
And here's your order. We want to keep that handy too in your folder, but I'll put it in when we get it to next time. And here it just tells you Gamma Guard 10% liquid through a syringe pump every week over 1 to 2 hours. 8 grams is your dose. Now before I'm sure your dose was quite a bit more, like maybe 40,
35,
45. Yeah. So, but see that this is going in every week. So if you multiply that by 4, then you're into 32, and you need maybe just even a little less because it's keeping it at such a nice level for you, you know.
Okay.
So that's perfect. And your it says 315.12.
For some reason, my doctor or my insurance will only allow it for 1 month, maybe to see.
To see how it goes.
Yeah.
I'm sure that it'll be renewed, but maybe they just kind of on a trial basis, so to
Right.
speak. I'm feeling this is a little cheaper too,
Yeah.
because to have the IV stuff, I know the IV stuff is expensive, but then this has got to be expensive too in the same similar way.
Yeah.
But you don't have to pay for the nursing part because
Right.
it's so easy after you
Right.
get going, you know. Okay, and then no lab orders, so that's good because after you get on your way, we don't come out every time, but we will if you need anything. If you need any, if you have any concerns or whatever, we'll come out and do a visit with you and just make sure everything's fine or whatever. If you ever had any problems. But it's just that once you're on your way, you probably don't need us very much, you know.
Right.
But we are available if you have questions. Pharmacy, 24-hour a day, on call. If
Okay.
you ever had any problem
And
at nighttime even.
I can go to my primary and get my blood work done.
Yeah.
Okay.
Yeah, that's good. Sometimes doctors will order some labs, and then we have to write or let them know that, after the patient's independent on their own, they're really not going to be getting visits. We're not allowed to come out and just draw labs because
Right, yeah.
there's no reason you can't stop somewhere unless you were homebound. If you're homebound, then we do labs, But, so that's good in a way. They're not ordering through us, but yet they will be checking them, I'm sure, when you go
Okay.
into the doctors, right?
Okay.
All right, so that's good. So you could probably get snuggled back in. I won't
All right.
disturb you again.
Oh no, you're
I
fine.
think we keep thinking of things we need. It's good they have gloves here. You don't really need them as long as you have clean hands. Did you already wash up,
Yes.
sweetie? Okay, great. So you can use them if you like. It's not a bad idea, I suppose, especially if you're washing them and then you're touching the cat or the the thing or whatever. You know what I mean? Or your blanket, things like that. So yeah, I know that'd be one thing to keep the pets off the area where we're gonna
Yes.
work. But it's not. This isn't like a sterile thing, but when we access the medicines and we put the needles in, it's sterile.
Okay.
Otherwise, it's a clean procedure, basically.
Well, that'll help, Angela.
It's gonna blind me now. Please don't do that.
You need some lighting in here, Angela.
See, you're older like me, so she's feeling like, hey, these older eyes, they need all the light they can get. But actually, I'm fine.
Are you
Especially-
okay?
Yeah, I really am.
Okay.
I can see fine.
No, it would
So-
open up the blinds if anything.
You could do a little angling there if you want to, but
Our
yeah,
light
that's a
bulb.
little more subtle. Yeah, that's kind of nice. Okay, what else was I looking for?
And then I just read off the, what you call it? The few plaques in there, I gotta get that information.
Okay, where are my little jobby
Shut
dudes?
this thing
There we go. That's what I wanted.
It just shut off.
Did I take them out?
It just shuts off?
No.
No, well, if your elbow
just-
hits it, it'll turn back on.
Okay, fine.
I thought I saw two more of these, you
You
guys.
got batteries
Am
for
I
it?
imagining this? Were there two more of these?
No.
Okay, so it's just the one. One is extra. Okay, that's right. All right, so this is pretty much what you would do to set up. You want a clean work surface, which, by the way, your table looks perfectly clean, but I kind of like these little drapes because
yeah.
they have, look, a plastic underneath. And this stuff, I must say, is kind of thick and viscous and sticky. So
Okay.
if you make a drop on something, it's a little
Right.
bit, it's not like water, you know what I mean?
Right.
So it's kind of nice to have either paper towel or something, but this is nice because it doesn't go through, since it's got that plastic underneath.
I do have that too. They said.
Oh, they sent a cool thing?
Yeah.
I love
So-
that. Plus it's got instructions right on it.
Yeah, like that's
Oh,
a similar
man.
thing, right? Is what you're talking about? Okay.
Yeah, but see, mine's just paper. This
Right.
is very cool, and you can wipe it down. What is this? It's supposed to stick. Oh, it's like, I don't know if it sticks, but it's like,
I
it's
think
rubberized.
it's to hold
So
it in
that it
place
doesn't-
probably, so it doesn't move probably.
Isn't that kind of cool?
Yeah.
Would you rather use that instead
Oh,
of
it-
this thing?
It don't matter.
Next time, how about that?
Yeah.
Yeah.
But the thing is, this is nice because it's got some info on it. It's got a picture of the pump, some of your supplies.
Yeah, I set it up all night last night. I set everything up on where it should go.
You are so cool. That's excellent. You really are prepared. Then you're sure you don't care if we don't use this, though, because you already tried it. It might be good to follow up if you were setting things up like that.
We'll do it next week.
Yeah? Okay.
Yeah, because then that way, because I'll be more on my own next
Yeah,
week. you said,
right,
too,
true.
so.
And it won't be unlike this, obviously, but it's just that, I'd like you to feel comfortable with your own routine. They gave you some extra syringes, too.
Yep.
And this is after for when we have the pump. I think we got everything. Okay, so I was just double checking your dose. I see you got it at room temperature.
Yes,
Right on
I
the
put
ball,
it
I
on
swear.
there, yes.
You are so good, I swear. All my patients were on the ball like this. Be perfect. Okay, so the big vial is 5 grams. These must be each one because remember it equals 8. So yep, 1 gram, and 1 is 8 grams altogether. So that's always a good thing. Now, to double check your dose. So this is what you could be used to seeing all the time. This is 50 mLs. And these are
100.
10 each. So that's going to be 80.
Yeah.
Okay. Now, the reason they sent you two things is because each of these is only 60. So we got 80 mLs, so we're going to end up using 2 syringes. See what I'm saying?
Okay, that's what she was telling me.
Was she saying that on the
Yeah, and I didn't
pharmacist?
quite understand. Yeah, and I didn't understand it. Okay.
Right. So some of them are a little more concentrated than others. So this might not be quite as thick, which is kind of nice in a way, you know, because it won't be as hard to pull up and stuff like that. But the downside is that it's got to be divided into 2 syringes.
Okay.
So I don't know if we should do 50 and 30, maybe, just because it's easy to pull up the one in one syringe and then switch over and do 30 in the other.
So you said 60 is all these can take.
Right, so we
Okay.
would only need 50 for this one. 'Cause
Right,
this is
and
50, so there'd be 10 extra that we, empty.
Just won't use,
And then
right.
30 out of the 60 in this one.
Okay.
Okay?
All right.
That sounds good. And we got our alcohol. So this is kind of how your setup's going to look. You're going to need the big tubing that has the needles at the end.
Okay.
And it also has these little dressings that I'll show you when we open that up more. For sure you
Okay.
saw them. You were good. And then this is the flow regulator, which has to go on there to help you restrict it from going, it
Too fast.
allows it to, allows us to control. Because this is a real simple syringe pump. It's a mechanical device. It's not electronic or computerized or anything. No batteries, nothing like that. It is nice because it hardly ever goes wrong, right?
Yeah.
Nothing can go wrong. And it's it works really well. And it, what was I going to say about it? There's no alarm or anything, but it's very simple, and all you do is have to put the syringe in, it just constantly pushes. But it'll push it according to how much resistance is in the tubing. So we give you a little smaller tubing, so it slows it down at first, to make sure that you do well. And then after the 4-week mark, they might change this tubing from the Freedom 60. This is the F275. They'll change it, and you'll notice maybe a different number, and they'll probably talk to you about it. They might say, would you like the faster tubing? You'd have it in about an hour instead of whatever. It might take an hour and a half today.
Okay. Yeah, no, the longer the better for me. I'm always good with longer.
Yeah, and who cares, right? You're going to be doing this at night, watching TV, or doing something relaxing, right? So it's like another half hour. It's no big deal. But what's good is,
anything I can do to minimize the side effects. So.
Yeah, that's what's nice about this, is you're going to love that it has hardly any side effects.
Right.
Usually you get a little bit of pinkness, a little redness, like that irritation feeling at each of the sites that you have.
Okay.
And also you might get a little bit of swelling, but you almost always have to have some swelling because you're infusing some fluid
And
under your
staying
skin
there, right.
Yeah, so it's just a little bit of a mound.
Right.
And it's not a big deal. It's not like a golf ball thing sticking out. And it only stands to reason that you've got fluid under there that's going to be slowly absorbed through the week, so you can have that little bit of swelling. And that's the joy of it, though, is that it's in the fat tissue, which doesn't have as many blood vessels. Right. So very slowly it gets absorbed throughout the week. If it went into the muscle, then muscles have a lot of blood vessels, so it would absorb fast.
Right.
So that's why the needles are so short and skinny, and it's really nice because you hardly feel them.
Right. Okay. Well,
okay, so let's get started. You know what, I don't want to drop your drink or mess your drink, but I kind of wanted to get your...
I'll set it over with my
Are you
mom.
sure?
Yeah.
Okay. I'll take a sip before you go?
Yes.
Okay.
I am very nervous about this. I apologize.
You are nervous?
Oh, yeah.
Oh, it's going to be so easy. You're going to be surprised. You're going to go, why was I getting so freaked? But what's good is you're nervous enough to do all this preparation, so you're better prepared than the average person.
Joe, or
honey, I love you, but I got to
Daisy.
stay clean, sweetheart.
Daisy, come here. Daisy,
I'm sorry.
come here.
Let her outside now.
Come here, Daisy. Come on.
Come
on, buddy.
Come on. It's so hard not to pet her. She's so cute.
I'm
adorable. No problem. I just don't want to get dirty, right?
Yes.
Yeah.
All right.
She didn't touch me much, but this is good. Hey, I really love that you have a log started. Did they do that for your IVs?
I ordered those.
I know, but when you did that from your IV, that was so smart. Most people don't do it for their IVs. They only start one at home because they're independent, doing their subq one. Whereas the IV one, the nurse is here and keeping track of stuff. But you're doing your own thing.
Education is key. And that's the key.
Okay.
You have to be your own self-best.
So on the ball. I just love it so much.
The more
Plus,
information I know,
back.
the more comfortable I feel. So
Yes, that's That's excellent. You know, what's good too is you can keep track, you know, of how you were feeling and what the benefits were.